MDNews Network's David McDonald recently attended the Medical Group Management Association's annual conference in New Orleans, where he caught up with Nancy Enos from Enos Medical Coding. Here's that special report.
So I'm David McDonald with MDNews Network. We're here at the MGMA in New Orleans, Louisiana, and we're talking with Nancy Enos, who's a certified coding instructor and who is very knowledgeable about the aspects of coding. Nancy, we know that a lot of physicians aren't engaged in coding, or there are some compliance criteria that they need to be aware of. What are you seeing out there?
I see a lack of preparedness in offices because of the time constraints and responsibilities, but with the healthcare reform, there are going to be new elements that will require a compliance program to be in place as a condition of participation with Medicare and Medicaid. So that will really raise the bar and force the issue, where practices who may have been complacent about an active compliance program will now have to put more time and attention to that effort.
Right. Well, I mean, so we have these are sort of old compliance rules, right?
They've been in place since 1990, and they were a suggested guideline as opposed to now it's a requirement.
I see. So with regard to meaningful use and electronic medical records and so on, how does this fall into all of that, and is this causing more confusion for the physicians?
It certainly adds another layer of responsibility, but it's not really directly tied into meaningful use or EHR, although the implementation of electronic records certainly does help with having good records and documentation, which is what we're looking for.
So these physicians, I mean, on a percentage basis, is there a high percentage of physician practices that are not compliant, as you say?
I wouldn't say that they're not compliant. I would say that they don't have a documented compliance program. So they may be doing the right thing, they just don't have it written down anywhere. And unfortunately, the new healthcare reform is going to require that they do have a compliance program. So formalizing what they're doing and making sure that they have an outside audit every year, make sure that they have continuing education with regard to all of their coding and billing.
So do you feel like this is, again, is it going to add another layer of frustration? Do you think they'll actually come along if they haven't had a documented compliance program for 1990 to 2010 for 20 years? Is this really something they're going to be able to pay attention to, given that they're also having to pay attention to so many other aspects of healthcare patient management from the reform perspective?
Well, I think that unfortunately, if they didn't do what they should have all along with compliance, it's going to add another burden. Yeah, they really should have done it before now.
Yeah.
Unfortunately, if it falls at the same time as other burdens, then it's just going to make it doubly hard for them to do it. Yeah. I don't think it will cause frustration. I think that practice managers have been aware, and physicians have been aware all along, that compliance was required.
So do they, in order to become compliant at the level that you speak of, do they need to call an outside resource? I mean, as a compliance expert, is it somebody that, like you, that would come in and help them, or are they able to do this and implement this with their own staff?
There are growing numbers of certified professional coders who are working in the medical field today, who might be in place in a practice, who would be able to put aside some time and do an annual chart audit. It's only 10 records per provider. So in a small practice, they may have the resources inside. Other practices may not have the resource, and that's where they would turn to a consultant to come in and handle it on a project basis, which is much less expensive than hiring another full-time employee.
Interesting. So these physicians that are not compliant, smaller practices, bigger practices, hospital-owned physicians?
I think the middle to the smaller practices have been challenged with getting this done. I see more organized compliance programs in the larger practices.
Oh, that's good. And physician-owned practices, or hospital-owned practices rather, are always compliant?
Yes. I think that hospital-owned practices have the resources and they certainly have more exposure, so they're very careful about compliance.
What's the benefit for if a guy who hasn't been doing it, or a man or woman who hasn't been doing it for 20 years, what's the benefit now to do it? Although it's required, what's the benefit? Oh,
I think that there's always a benefit that comes out of the exercise of looking to make sure that all the coding, documentation, and billing has been done properly. Many times it reveals an opportunity for additional reimbursement. It's an educational, and it's a good time for some housekeeping.
But it's also potentially a layer of cost.
It is, but there's also a huge cost if there is a RAC audit and the provider didn't take a look at his own records beforehand and was caught unawares and had to write a $40,000 check or an $80,000 check back to a payer. So it really is preventative care.
Obviously there's no insurance for that. A $40,000 cost and fines is pretty substantial to physician practice.
It is. I recently learned about insurance policies that will cover the cost of going through the audit process, of defending a RAC audit, and all of the legal costs associated with that, but the insurance would not cover any overpayments that had to be returned.
So compliance is the way to go.
Absolutely. Keeps practice out of trouble, keeps the practice healthy.
Thank you for your time.
You're welcome.
Appreciate it. Again, we're with Nancy Enos at the MGMA in New Orleans, Louisiana.